Hello viewers and a very warm welcome. You're watching India Fights Back with your host Kriti Mishra. Center has said that 216 crore doses of COVID-19 vaccines will be available between August and December this year for Indian citizens. NITI Aayog member Dr. VK Paul has said that it will be enough to vaccinate the entire population and the vaccine will be available for all. He said that the number is likely to reach 300 crore doses by the first quarter of 2022. Dr. Paul estimated that 75 crore doses of Covishield and 55 crore doses of Covaxin are expected between August and December this year. 6 crore 60 lakh doses were procured under PM CARES Fund and were utilized fully. An additional 16 crore doses are in pipeline to states and private hospitals. So far, 1 crore 65 lakh free doses have been supplied by the center to the states, while 2 crore 35 lakh doses will be supplied to the states in the coming days. And to discuss the roadmap ahead for the supply of vaccines, I'm joined by Dr. Rakesh Agarwal, Director, Jawaharlal Nehru Institute of Postgraduate Medical Education and Research, Puducherry, and Dr. K. Madan Gopal, Senior Consultant, Health, NITI Aayog. Welcome to Rajya Sabha Television, gentlemen. And Dr. Agarwal, coming to you first. 216 crore doses of COVID-19 vaccines will be available between August and December this year for Indian citizens. What is your take on country's vaccination policy so far, sir?
I think the policy has been very well decided. We started off, as the rest of the world did, of prioritizing the vaccine for people who were at the highest risk, the healthcare workers. That's in keeping with the WHO's roadmap for vaccination around the world. All countries have done that. We also prioritized the frontline workers. The next thing was to protect people who are at a high risk of getting severe infection, needing ICU care, having mortality. That is the 60-year-old. Then we went on to slightly lower risk group of 45 to 60 and people who have comorbidities. And then they have tried to open for other groups. The only thing that one could say is possibly we opened a bit too early for younger groups, but I think there was a lot of pressure from the public and that's why this was happened. But otherwise, I think this is how it should be. You have to start from the highest risk group and go to the lowest risk so that you can get the biggest bang for the buck. What you have in the beginning, you can get the maximum advantage. And that's what we have done. Entirely with the word policy.
All right, so it is in consonance with the world's best practices. And talking about the immunization program, Dr. Gopal, India runs one of the world's biggest universal immunization programs. And in comparison, the COVID-19 vaccination efforts are even more gigantic. So a roadmap ahead for the supply of vaccines to the entire population.
Kriti, that's a very important question in the current context. If you look at the efforts made by the union government, the government has been consistently and proactively working to secure and enhance the availability of the vaccines. They have liberalized strategy and they have made specific provision that the vaccines of COVID, they have fast-tracked the regulatory processes. Apart from that, they are allowing others to, in the form of providing bridging clinical trials. That kind of prioritization has happened. As a result, things have fast-tracked. You look at the other vaccines also now, for the foreign vaccines also, they are trying to see that how we can fast track the entry of this foreign vaccine into the country. Another thing which has is that they are trying to ramp up the domestic production. How the 300 crores will come, that thing has been, you have already mentioned during the initial opening remarks. But as a part of his policy, as a part of the government policy to augment the production of this, the NACVAC has been in touch, NACVAC and the other concerned department, they are in touch with the manufacturer, then trying to explore how the productions can be ramped up. You're seeing that kind of efforts, which you will be seeing, and as a result, you can see an horizon of around 300 crore doses by early next year. That's a horizon which we can see based on the efforts made by the government. Apart from that, we are trying to see that because the Covaxin, which is indigenously produced, that requires a sophisticated BSL 3 category laboratory, which is not many pharmaceuticals they are having this thing. We are trying to see that if others are interested, the knowledge transfer and other things are also being facilitated. We are trying to see that more and more manufacturers can also open by way of their this, but that offer is there to all the manufacturers. Now we are trying to see that how many will try to get into this and try to contribute to the ongoing national program. If you look at the way the things have been progressing, the results are quite encouraging. Initially, there was quite hesitancy, but now, as you might have seen, that we are the country which has done fastest to reach 17 crores marks. That is 113-14 days we have been able to reach. But the only limiting factor was the supply of the vaccines. We are only dependent on two. Now with the entry of other vaccine suppliers, this speed will all go up. Now the Sputnik vaccine has also arrived in the country with 3 vaccines now there, and talks going on with the other vaccines that they will, if the kitty increases more, then we will be increasing the speed more. Over to you, please.
Right, sir. There's another important decision that the government took, Dr. Agarwal. It has widened the gap between 2 doses of Covishield vaccine to 12 to 16 weeks. How do you assess this decision?
So this decision has 2 components. One component is the vaccine's efficacy or effectiveness, and the second is the public health approach of trying to immunize maximum people. From both points of view, it's a correct decision. The decision that the interval should be larger than what was initially done has been apparent for some time, and there were data from the trial that showed that people who had a 12-week interval, when in the period between the 4 weeks to 12 weeks after the first dose, they were sufficiently protected, and therefore one could increase this interval. However, those data were not the randomized data. Those were data from something that we call as post hoc analysis of the trial results. And therefore, there could be some questions about it. Therefore, the initial decision was not to act on it, or to act on it partially, go up to 6 to 8 weeks, but not beyond. Now, data of the actual field use of the vaccine that we have, the Covishield vaccine or the AstraZeneca vaccine, are now available from several studies. And there we know that up to 12 weeks, it can be perfectly extended and possibly even longer. Actually, Canada has gone ahead and said that they will use the interval of 4 months. And that allows us not to lose anything for an individual person who gets the vaccine by getting only 1 dose. He does not lose anything, but as a country we gain. So these 2 approaches are not, some people are making it out as if these are alternatives or antagonistic approaches. No. From both points of view, it's a win-win situation. An individual also gains by increasing the interval, and the population, the community as a whole gains, and therefore it's a perfect decision which helps an individual as well as helps the society.
It's a win-win situation for all. But talking about vaccine production, Dr. Gopal, the central government has already rendered financial support to the various public sector players to boost the vaccine production capacity. What more needs to be done, sir, to ramp up production?
It's a very difficult question to answer because the efforts, the government is already doing their efforts, and the 2 vaccine producers, they are optimally producing whatever the capacities they are having. They are optimally producing the vaccines. Now you require more setup. It's not that easy that any pharmaceutical company can come up and they start producing from the next day. Suppose today, if somebody wants to expand the facility, they have to have a chamber, biodigester chamber. And if suppose I start work today, it takes around back to back with next big speed. It takes around 3 months to start that production. So that kind of efforts are already going on. It's not that from today we are starting it. Efforts are there for ramping up. Efforts have started during the last months of the past year. They are already there. So they are already trying to ramp up the facilities, and that's as a result. The current capacity is 7 crores per month, vaccine doses per month. which would be ramp up from the next month, it would be 10 crores. Then in the coming days, as the member NITI Aayog has pointed out that as a result of all this ramping up, you are getting to see more doses of vaccine in the horizon. Otherwise, it's not possible. That's why we have been able to project that by September to December, how many doses will be available. That kind of efforts are there. And side by side, parallelly, efforts are being made to bring in to get the global vaccines as well. That efforts are going on. You see that how quickly we can get a stockpile and how quickly we can go with the vaccination of whole of the population, which we have prioritized.
Absolutely. But this also reminds me what the finance minister had said, that this is not the time for vaccine nationalism. Dr. Agarwal, way ahead for entering into technology transfer agreements.
So technology transfer agreements are possible. They have to be done between companies. Governments can help in facilitating that, and I'm sure the government of India is trying to do its best to do that. Now, this technology transfer agreements can be for manufacture of vaccine, or they can be for manufacture of some of the components that go into making a vaccine. So each of those could lead to increased production capability of the vaccine in the country. Also, please remember, vaccine is only one thing. There are many other things that are needed. You need glass vials to package these things. You need, packing material. You need sometimes maybe even transport material would be needed for some of these vaccines, which have to be kept at a very low temperature. So we need lots of syringes. So all those logistics are also being arranged. But technology transfer, I'm sure, is happening for vaccine as well as the vaccine components.
All right, and talking about this third phase of vaccination, Dr. Gopal, this is the liberalized pricing and accelerated national COVID-19 vaccination strategy that aims at liberalized vaccine pricing and scaling up of vaccine coverage to incentivize vaccine manufacturers also. So how different is this phase from the earlier two phases? And going ahead, what are the achievements that you're looking at?
As you look at the policy, we had policies in three phases: phase 1, phase 2, and phase 3. Phase 1 was targeted towards the healthcare workers and the frontline workers. Phase 2, we have opened it to 60 plus population and 45 plus population. Now, with the request of the states have been saying that it should be open to all the population, that is all the adult population. Based on the request, it was a request from a lot of the states saying that we will be buying the vaccines and we will be inoculating the 18 plus population. So this is a very, it's a very a decision in the right direction. As a result, the people who are vulnerable, they can be protected. That's one thing. The another thing is that the central government is procuring it, and it is committed to provide vaccination to the first two priority groups, which it has identified and which is doing it. The third group has been demanded by the states, and now the states are taking the responsibility of providing vaccination to this. If as the situation of the vaccine supplies improves, all the three things will yield good results.
All right, you're talking about states, Dr. Agarwal. I'd also like to elicit your views on that. States have called in for global tenders. How do you think the states are faring? What is your suggestion to the state governments respectively?
I really, let me admit, I have no idea about how states tenders are faring. I don't work in that space, so I really don't know how that process is working. I am a medical person. I'm on the science side. I really don't know how tender process is working.
All right, sir. Talking about the vaccination strategy, now that India has expanded the basket of vaccines, what is your opinion on safety and efficacy of available vaccines and the new vaccines that we are looking at?
So safety and efficacy of each vaccine is looked at individually, both at global level, so WHO looks at that, and each country's regulators look at it individually. So we have our regulator, they have already approved 3 vaccines, they have the capability to do this, and each vaccine is also looked at by the global, by the regulatory authorities in other countries, because we have said that we are open to vaccines that have been approved in other countries, provided our regulator also looks at them in a relatively fast manner. This is a standard process that is done around the world. So I don't see any reason why there should be a concern about efficacy and safety. If there is one thing we can say today, drugs and vaccines are extremely safe and extremely effective. The risk of zero cannot be achieved in anything in life. If that were the case, then you and I will not be traveling in cars, we will not be sitting in planes because the risk is not zero. We can only find out the major risks. Today, the size of trials that we do, if something can happen in 1 in 15,000, 1 in 20,000 people, that would be picked up during the trial. It's only very rare things that are not picked up and those come up later. So I have no question about the safety and efficacy of these vaccines.
All right, Dr. Gopal, you were talking about states as we were talking that states have come up with their own global tenders. What is their strategy? What is your suggestion to the state governments?
Priti, strategy is very simple. They will be planning they will be getting vaccines and they will be planning vaccinations as per the vaccination sites which they are planning to have that. They will follow the same strategy which they have been doing for the last many years. Is nothing going to change except that they will be procuring the vaccines. They will be getting vaccines from the central pool as well, and they will be planning the vaccination sites and the vaccination. The vaccinators training, everything they would be planning, and they would be inoculating people. Nothing is going to change.
Time for closing comments from both my guests. Dr. Agarwal, India's approach has been built on scientific pillars guided by global best practices and SOPs of WHO on vaccination. Your closing comments, sir.
I already said that our principles of vaccinating, principles of prioritization, principles of ensuring equity have been very similar to what is recommended around the world. And I think the best brains are working on developing these policies and deciding, taking decisions. And of course, there are challenges in vaccinating such a large population. We have to realize that we have a much larger challenge than most other countries have. The best performance has been of countries such as Seychelles, which have a total population of 1 lakh. So with the population we have, I think we have done well and we will do well.
Dr. Gopal?
We are following the time-tested strategies. The only thing is that how we quickly do it, how we quickly saturate our priority groups, the frontline worker, the healthcare worker, the 45 plus population. Till now, we have been able to cover only 33% of the 45 plus population, which contributes to 88-90% of the mortality. And see that how, despite having a large number of cases, still we have been able to give protection to this vulnerable section of population. We have to go as per the priority population and see that how we popularize and see that more and more people get vaccinated.
So that reminds me of a specific strategy of the states, because each state, they have to adopt a different strategy. Some states are reporting more than 1 lakh cases and some states are reporting lesser than that. So there has to be a different vaccination strategy as well as far as the states are concerned, Dr. Agarwal, and then I'll come to you, Dr. Gopal.
So the strategy of selective vaccination can take into consideration two things. To me, as a scientist, even today, if a state can prioritize, it should prioritize the vaccine to the elderly and those who are at a higher risk of severe disease, ICU admission and mortality, because that is our biggest challenge. People not getting oxygen, people not getting hospital beds. The second strategy could be that if we can identify a specific subgroup that could be based on place of residence or something else that has a higher risk of disease, they could prioritize them. That is the only thing that is scientifically valid that I can think of.
Dr. Gopal?
For any pandemic management, one of the priorities is to reduce mortality due to this infection. Second thing is to reduce hospitalization. We have to ensure that the mild doesn't become moderate, moderate doesn't land up into severity. So in that direction, if you identify that who are the most vulnerable and in which age group the mortality is high, so we are targeting the same thing as Dr. Agarwal has mentioned, that we are progressing in that direction. So we have to adopt that kind of approach for any pandemic. Across the globe, it has been adopted.
And of course, let's hope that our vaccination drive covers the entire population as soon as possible. On that note, thank you so much for joining us. Well, that's all we have for you in today's edition of India Fights Back. But before that, let me remind you once again to stay safe from the coronavirus pandemic. Remember to wear a face mask and wash your hands and face regularly, and ensure that you maintain physical distancing whenever you're stepping outside. These simple precautions are all it takes to defeat the pandemic. Take good care and goodbye.